Infertility is a disease of the male or female reproductive system defined by the failure to achieve a pregnancy after 12 months or more of regular unprotected sexual intercourse. According to the Director General of National Population and Family Development Board (LPPKN), the Malaysian Population and Family Survey showed that infertility problems among married couples had increased from 6.9% in 2004 to 8.6% in 2014. The percentage is now expected to reach 10 to 12%, which is nearly the global rate of 10 to 15%.
Now, let's take a look at some of the factors that lead to infertility. Infertility happens due to four main factors, which are infections and diseases, the prevalence of medical disorders, damage related to cancer and its treatment, and lastly, environment. Some of these factors are categorized for men and women. For the first cause, which is infection and diseases, the first infection that causes infertility is gonorrhea, which is a sexually transmitted infection caused by bacteria that mainly spread when in contact with body fluids. It can thrive in a female's reproductive tract, causing pelvic inflammatory disease, PID. It is a condition where the inflammation occurs in the upper genital tract, whereas in males, it causes epididymitis, where you can see the male scrotum got swollen or discolored. The second infection is HIV, a very well-known infection. If a male has HIV, it will cause inflammation in his testicles and reduce the production of testosterone. If a female has HIV, issues in the menstrual cycle and no release of eggs during ovulations will occur. Next, TB or tuberculosis. TB is bacterial and it can cause lung infection, but it can also spread and cause secondary infection. This secondary infection is the one where bacteria reach the fallopian tubes, then attack the uterus and cause uterine tuberculosis, pelvic TB. And that's for females. For males, it will cause the same disease as I have explained earlier, which is epididymitis. Lastly, PID, which I have mentioned before. It will cause scarring in the fallopian tube, and the fertilized egg will grow in the fallopian tube instead of the uterus, which is dangerous for the mother. Now, down the second factor. Medical conditions like PCOS also cause infertility. If someone has PCOS, the ovaries will produce an abnormal amount of androgen hormones. Too much of the hormone results in follicle arrest. Next, diabetes results in irregular menstrual cycles for women, while for men, it can cause problems in getting and maintaining levels of testosterone. Another medical disorder is hypothyroidism. It is one of the highest factors that lead to infertility alongside PCOS. It is a condition where you have a low level of thyroid hormone, and this will interfere with ovulation. Hypertension, on the other hand, can affect the blood vessels of men and women and hinder the blood supply. It damages the male's testicular vein and the female's ovarian vein. Lastly, obesity can cause the overproduction of the insulin hormone and leads to irregular ovulation in females, whereas for the males, it reduces testosterone production and decreases sperm production. The third factor, chemotherapy, one of the cancer treatments, causes premature ovarian failure and lowers the number of total eggs in the ovaries. Besides chemotherapy, radiation therapy near our abdomen, pelvis, or spine can harm nearby reproductive organs. It will cause the primary ovarian failure, affect blood flow in the uterus, and harm the pituitary gland in the brain, which is important for sending signals to the ovaries to produce hormones such as estrogen, which is needed in ovulation. Moreover, hormone therapy, also called endocrine therapy, is a treatment where estrogen and progesterone will mimic the hormone that decreases during menopause, and this can decrease sperm and egg quality. And the last one, environment. How environment affects fertility. First, exposure to air and water pollution. It can damage the reproductive system and disrupt hormones. Second, exposure to harmful chemicals. They lower sperm count and movement in males and disrupt hormone function in females. Third, temperature and excessive heat. For those who like to go to the sauna, especially men, be careful as the heat can reduce the production of sperm and produce abnormally shaped sperm cells. Last but not least is pesticide rates. Pesticide-laced food like strawberries and green leafy vegetables can reduce fertility in both men and women.
Next, I'll be talking about infertility treatment and its procedures. So, the treatment that we choose is IVF. So, what is IVF? IVF is a complex process that involves retrieving eggs from ovaries and manually combining them with a sperm in a lab for fertilization. Several days after fertilization, the fertilized eggs that are called embryo is then transferred to the uterus.
This technique is often used when other fertility treatments have not been successful or are not viable options, such as if a woman have blocked or damaged both of her fallopian tube that make it hard for an egg to be fertilized or for an embryo to travel to the uterus.
Let's go through the process of IVF one by one. First, we begin with ovarian stimulation. Normally, a woman's ovaries produce one egg per month. With IVF, we need multiple eggs, so we use hormone injections containing FSH, LH or both to stimulate the ovaries to produce multiple eggs. These injections are administered daily for about 10 to 14 days, and then we can see the progress through regular ultrasounds and blood tests. The results of the blood test often used together with an ultrasound of the ovaries that can help doctors to estimate the number of follicles inside the ovaries and can predict how your ovary will respond to fertility medicines. Then, once the follicles are mature, a hormone called human chorionic gonadotropin (HCG) or other medicines is used to help egg mature fully and get ready to be harvested. After that, medications that delay ovulations are needed to prevent the body from release the developing eggs and to ensure that the eggs are not released prematurely. This ensures that the eggs remain in the follicles until they are ready to be retrieved. Next, we move to egg retrieval step. At the beginning of this procedure, an ultrasound probe will be inserted into the woman's vagina to view the ovaries and look for fluid-filled sacs, which we call follicles. Then, the long thin needle that connected to a suction device is used to pull the eggs out of each follicles. Next, fertilization. There are two ways of fertilization in the lab. It can be done by injecting a single healthy sperm directly into the egg. This method called intracytoplasmic sperm injection or ICSI is shown in the video. Second is fertilization through conventional insemination, which healthy sperm and mature eggs are mixed in a dish and kept in the controlled environment called an incubator.
The third part of in vitro fertilization is called embryo transfer, which is done 3 to 5 days after fertilization. During embryo transfer, a tool called a speculum will be inserted into the woman's vagina so that the doctor can see her cervix. A syringe will be loaded with fluid containing one or more of the hatched embryos. Then the syringe will be attached to a long, thin tube called a catheter. The doctor will insert the catheter into the vagina, through the cervix, and into the uterus. Once inside the uterus, the doctor will inject the embryos. Then the catheter and speculum will be removed.
After the process of fertilization, there is another step called embryo transfer. As you can see, once the embryo are ready, the best quality ones will be selected to be transferred to the uterus. So there are two kinds of embryo transfer: fresh embryo transfer and frozen embryo transfer. A fresh embryo transfer means your embryo is inserted into your uterus between 3 and 7 days after the egg retrieval procedure. A frozen embryo transfer means a frozen embryos that are from a previous IVF cycles or donor eggs are inserted into your uterus. Last but not least, supporting the uterine lining. Progesterone supplements are given to support the uterine lining and enhance the chances of implantation.
There are 4 ways to increase fertility: by eating foods rich in antioxidants, eating a bigger breakfast, prioritize omega-3 fatty acids, and minimize refined carbs. For the first way, eating foods rich in antioxidants can avoid deactivate free radicals in body that can damage both sperms and egg cells. Taking more vegetables, fruits, nuts, and whole grain can increase antioxidants because these foods tend to be higher in antioxidants like vitamin C and E. Next, eat a bigger breakfast can improve some of the hormonal effects of PCOS. It stands for polycystic ovary syndrome that affect fertility. If the higher calorie intake earlier in the day, it may improve PCOS symptoms. Greek yogurt, eggs, and oatmeal are the great choices to take at the breakfast, as the food are high in protein and carbs. Moreover, prioritize omega-3 fatty acid is important to help build the acrosome of the sperm because it has the ability to reduce oxidative stress and inflammation. For people with PCOS, omega-3 fatty acid can protect against heart disease. Omega-3 fatty acid can be found in fatty fish, chia seed, and walnuts. Last but not least, minimize refined carbs, as these carbs will be absorbed in the body and can cause spikes in blood sugars and insulin levels. The refined carbs are found in sugary foods, drinks, and processed grains. By reducing this type of foods can improve ovulations, sperm parameters, and hormonal balance.
لله ملك السماوات والأرض يخلق ما يشاء يهب لمن يشاء إناثا ويهب لمن يشاء الذكور أو يزوجهم ذكرانا وإناثا ويجعل من يشاء عقيما إنه عليم قدير.